This is a video about 3D printing in medicine explained by Safana, Laura, Priscilla, Sophie, Eric, and Math.
In this presentation, we will discuss the history of printing and development of 3D printing, the process of 3D printers, the use of 3D printing, and the ethics laws surrounding 3D printing. Believe it or not, printing has come a long way. When you think of printing, what do you think? Most times you think of a printer you have at your home or your office, something which is often accessible, ranging in different sizes and functionalities. But where did this all begin? Woodblock printing is a technique for printing text or images or patterns used widely throughout East Asia and originating in China. An image is created by carving onto a woodblock, then ink is applied and transferred onto paper. Next, we can see a printing press, which is a mechanical device for applying pressure onto an ink surface resting upon a print medium such as paper or cloth. Then we have screen printing, where mesh is used to transfer ink or dye, except in areas made impermeable to the ink by blocking stencil. A blade or squidgy is moved across the screen to fill the open mesh ink. One colour is printed at a time, so several screens can be used to produce a multicolored image or design. Then we have our traditional printers that we see in the homes and offices. Inkjet printing is a type of computer printing that recreates a digital image using droplets of ink onto paper and plastic substrates. Inkjet printers, as said before, are the most commonly used ones at homes and offices. Then lastly, we have 3D printing. This constructs a 3D dimensional object. The term 3D printing refers to a variety of processes in which material is deposited and solidified under computer control to create a 3-dimensional object, with materials being added such as plastics, liquids, or grains of powder being fused together layer by layer. How does 3D printing differ to your average printer? You don't need ink for 3D printers. 3D printers need a different type of raw material because they are not merely going to create two-dimensional representations on the image of a paper. They're going to create an actual copy of the object. Essentially, the difference between 3D printers and 2D printers is that of printing versus manufacturing. 2D printers are an extension of printing technology that has existed for a while, as I spoke about before. 2D printers have been made printing accessible to everyone. You can now print out hard copies of your text on papers or similar surfaces. 3D printers, on the other hand, have been used for the manufacturing aspect of many industries. They've been used to create miniature models for testing and developmental purposes. Also, they help reduce the cost of testing and developmental purposes since they often offer an affordable and fast alternative to regular modeling. The user also gets to save time and money whilst using a 3D printer, as it can also create a replica of this image. Now we will talk about the applications of 3D printing within medicine.
This part of the video talks about applications of 3D printing in medicine, as well as some drawings that we did to enhance explanation.
When it comes to the workings of bioprinting, we can start with the main stages involved in the bioprinting of an organ or tissue. Before any printing is done, a model of the tissue that we printed is necessary. As such, the first stage of bioprinting is the creation of a 3D model that will be used as instructions for the printing process. This model is created using various scans of the tissue that will be printed. This includes MRI scans and CT scans. Once sufficient imaging of the organ has been collected, the 3D model can be created on a computer. Medical scans are used for the creation of a 3D model in order to create as accurate a model as possible. Next, the actual printing must take place. In this stage, the 3D model is used by the printer in order to create tissue. Breaking this process down, we start with scaffolding. Scaffolding is used in bioprinting as the bioink being used is not stable enough to support the structure as it's being printed. As such, scaffolding is used to act as guidelines for the printing, as well as to ensure the overall structural integrity of the tissue as it is being printed. Scaffolding is often made from plastic, specifically biodegradable plastic. An example of biodegradable plastic that is used is polylactic acid. Polylactic acid is a polymer that's often used as it's simple to produce and breaks down easily in tissue. This is because the component of polylactic acid is lactic acid, a compound that's already commonly found in the body. Once the scaffolding is set up, the bioink can start to be added in thin layers. Bioink is used in order to create extracellular matrices within the tissue that's being printed. These bioinks are made out of biomaterial that are made into a hydrogel so that the biomaterial can be used as a liquid during the printing process. This biomaterial used is the main factor in how the tissue and organ develops. The biomaterials are typically cells. Human stem cells can be used for larger projects such as the printing of organs. Animal cells can also be used and repurposed for human function. With the help of scaffolding, the bioink is added in layers until the organ or tissue that is being printed has been completed. Finally, the printed tissue is left for cells to mature and the scaffolding to dissolve away. Once this process is complete, a bioprinted tissue is complete. There are 3 different types of bioprinting. Inkjet printing, which follows the more traditional route of using a bioink and printing layers of the ink over one another. Microextrusion printing, which allows for much smaller streams of bioink to be layered. The third type of bioprinting is laser-induced printing, which uses a laser in order to add layers of cells. While the 3 main stages of pre-printing preparation, the printing itself, and post-printing process, or cell maturation, is the same for all 3 methods, this video focuses on the inkjet printing method.
3D printing has various applications, from 3D printing organs and body parts all the way to prosthetics and instruments. 3D printing is an important step to help ease the life of humans in the future. A very essential application in the 3D printing field is body parts. How great would it be to walk again, be able to carry stuff, and regain health using 3D printing? That gives humans a chance to live their lives fully. 3D printing is used for surgical purposes, by giving the doctor a chance to perform the surgery on a 3D printed organ before humans. That way, doctors have a low chance of facing problems. An example to that is a 3D printed heart with arteriovenous malformation, also known as AVM, caused by tangled blood vessels between arteries and veins. That prevents blood from flowing normally. Therefore, a surgery is done on that 3D printed heart before a human's heart. Another application is a 3D printed face structure. Each of us has a different structure, making us unique in special ways. Performing surgeries on the face requires a good understanding of the medical problem. That application of 3D printing in this area helps apply the surgeries on humans quicker than when done from scratch. Another application is this artificial eye. The eye is a very complex biopart, therefore surgical practice on an artificial eye is required to prevent unexpected medical complications.
Another use of 3D bioprinting is for the creation of organoids. As you can imagine, organoid comes from the word organ. Organoids are smaller forms of organs that can be used for things like drug testing or the testing out of new molecules for treatment. Organoids are derived from tissue-resident stem cells or induced pluripotent stem cells. Organoids mimic the structure and function of the organ that they are representing. In this way, they can be used for disease modeling, taking on the same pathology of that disease but on a miniature level. The biomaterial is then printed into these intricate scaffolds, which creates the foundation to take on the shape and structure of the organ they represent. The biomaterial used to make these organoids starts with a single stem cell, which goes through expansion and self-organization into an organoid. A reason why this use of bioprinting is so exciting is that it can be used for precision medicine. Using a patient's own cells to make a disease model allows for a specific and customized model to be made. For drug screening, it could improve the monitoring of the disease and its progression. Individualized for that patient, it could reduce the trial and error situations that we might see in medicine. If we know what works for the patient before we try it, then there's a higher chance of it being successful.
Not only is 3D printing used for body parts and organoids, but also on instruments. There are many benefits in this area, including rapid prototyping, printing on demand, minimizing waste. It is also cost-effective and environmentally friendly. An application to that is 3D printing stethoscopes, just as shown here.
Another use for 3D printing is in the making of prosthetics. Prosthetics are artificial body parts, assistive devices for those in need. The great thing about 3D printed prosthetics is that they're completely customized to the wearer, fitting every detail of their body. With a 3D printer, they can be easily made, following the wearer as they grow. Another reason why 3D printed prosthetics are so supported is that they're easily made and accessible. Designs for 3D printed prosthetics could be easily found on the internet. The world of 3D printing has even started agendas where people with 3D printers can provide prosthetics for those across the world who might not be able to afford them. This has resulted in amputees from third world countries receiving prosthetics and being able to live the life they want.
When considering the development of any new medical treatment or technique, one can consider the ethical ramifications. 3D bioprinting has the potential to be a game changer, no longer necessitating the need for living or deceased human donation or animal transplantation. Despite a lack of current socio-ethical engagement with the consequences of the technology, we outline what we see as some preliminary ethical, practical, and regulatory issues that need tackling.
One can consider the physical and psychological risks to individuals as well as the wider impacts on society, particularly political, cultural, and religious concerns. These relate to managing public expectations and the ethics of biomedicine's continuing reliance on costly techno-scientific solutions, which leads to further social division. However, regulations could be designed in order to create legal frameworks to mitigate the risks of these treatments.
Bioprinting's game-changer abilities are hindered due to it being an expensive techno-scientific solution likely to benefit only a few members of a particular subgroup. Despite the promise of organs printed on demand for all, it is likely that the specter of a social stratification of biofabrication will emerge, with those who can afford to pay for their own organs benefiting. How can medicine that is so highly personalized be then social stratified to the rest of the population? Who would be first in trial, for example?
The future uses of 3D printing are difficult to predict. There is the possibility for creating a market of improving bodies beyond what would be considered medically necessary, giving people essentially superhuman type abilities like increased speed and strength. Whilst this could also improve patient quality of life, in relation to social stratification, this could further widen the gap between different economic groups by having some groups with enhanced bodies and some without. Also, this could create some religious or spiritual dilemmas for those who consider the human body to be sacred or potentially designed by a deity and would consider it to be playing God. Bioinks use differentiated human embryonic or induced pluripotent stem cells to print 3D constructs of living organic materials. There are ethical and political ramifications of using embryonic stem cells, the particularly controversial moral and legal status of embryos, as well as legal pregnancy termination. Many religious groups consider the use of embryonic stem cells to be completely unethical, and more generally, there is also the risk of coercion in the human donation of stem cells. Companies researching and developing methods and equipment for 3D bioprinting will be incentivized by the potential for profit. Profit is ensured by patenting, which prevents companies from utilizing each other's designs and techniques. However, patenting also creates the risk of the market being monopolized, which would reduce accessibility to these medical treatments in terms of availability and also cost to the patient, as companies lacking in competition can charge higher prices. It is also difficult to determine if the products themselves can be patented, as, for example, do tissues created from a patient's cells belong to the patient or the company who formed the tissue?
The efficiency and safety of the custom-made organs cannot be tested on other individuals. Therefore, in this respect, each patient becomes the first examinee. Consequently, the question arises of the ratio of risks to benefits, criteria of inclusion, for instance, the participation of terminally ill patients in experiments. 3D bioprinting technology can save lives and revolutionize the medical sphere. However, bioprinted items must require regulation. Therefore, it deserves special attention and development of an appropriate legal framework, specifically addressing social stratification, global inequalities, and the overall cost to essentially rid possible black market developments. Additionally, a collaborative approach between industry, hospitals, and academia is necessary to draw regulatory amendments which could further improve the clinical translation of bioprinted organs/tissues.